Good morning. I'm going to be talking to you today about the economics of healthcare, specifically focusing on COVID-19 and the profound and I'll argue lasting impact that this pandemic is having on the healthcare industry. In order to do that, I'm going to start with a little primer on healthcare economics, and I'm going to use Munson Healthcare numbers to illustrate a few key points. So I'll start with top line revenue. So Munson Healthcare as a system generates $1.2 billion in revenue on an annual basis. We generate this revenue based on the volume of services that we provide. So for every service, we receive payment. That's called fee-for-service reimbursement, and it truly is the basis of our reimbursement model for the U.S. healthcare industry. When we look at who pays the bills for healthcare, for Munson Healthcare specifically, you'll see that 70% of our payments come from governmental payers. That's Medicare and Medicaid. And with governmental payers, we're unable to negotiate pricing. It's dictated for us, and it's set based on state and federal budget line items. So as we think about governmental reimbursement, it is at best flat, and in some cases declining. So 70% of our reimbursement is either flat or declining. Now let's look at our expenses. So what do we spend money on? Over half of our expenses are our people, so salaries, wages, and benefits. The next largest expense, over 20%, is our supplies. And it's important to note that both of those expense line items increase year over year. We have to stay market competitive with our wages. We also experience inflationary costs in supplies, such as pharmaceuticals, from our vendors. So when you think about our top line revenue being either flat or declining and our expenses rising on an annual basis, that makes it increasingly challenging to generate an operating margin. And at Munson Healthcare, our goal is to generate an operating margin of 4.5% per year. So you may ask, I thought Munson Healthcare was a not-for-profit organization. Why do they need to generate an operating margin? Well, our operating margin as a non-for-profit organization is 100% reinvested back in our facilities and our communities. And in a normal year, Munson Healthcare will spend over $60 million reinvesting in our facilities through improvements, expansions, renovations, investments in new and innovative technology, and also investments to enhance our information technology platforms. And without a margin, we wouldn't be able to make those investments. We also, as a not-for-profit health system, provide significant support for our community. That comes in many forms, in community support, education programs, but it also comes through free and heavily discounted care that we provide to members of our community who are unable to pay for that service. So with that background, I'm now going to focus on the healthcare industry pre-COVID and some of the challenges that we were facing as an industry. I'm going to start with a cartoon because I think it pretty accurately sums up the U.S. healthcare industry. And I think most would agree we're at a point that we need more than a couple of cortisone shots to fix what is wrong with U.S. healthcare. And why is that? Fundamentally, our industry and our trajectory is unsustainable. And that's for a couple of reasons. Number one, healthcare represents 18% of our GDP as a country, and that is continuing to grow. We spend 2.5 times what other developed countries spend on healthcare, and our outcomes are worse. We also, in a number of studies, it suggested that as many as 30% of healthcare expenditures are actually unnecessary. And I talked earlier about that fee-for-service reimbursement model, so we get paid for every service that we provide. That creates an inherent incentive to do more, to increase our volumes. We do better financially when we do and provide more services. And so I'll argue that that fee-for-service reimbursement model is a large part of why our healthcare industry is unsustainable. And CMS is the Center for Medicare and Medicaid Services, again, our largest payer. I think it's important to note that they're focusing on how they can fundamentally get rid of fee-for-service in order to address the unsustainability of healthcare costs in this country. Now I want to look at this issue of healthcare costs through a slightly different lens, through the lens of our families in the United States. And you can see over the last 20 years, the burden on health and families in this country has increased significantly as they shoulder more and more costs associated with their care, as both payers and employers shift that burden to patients and families. We could show a similar graph for employers in this country, because employers who provide private health insurance, they also see year-over-year increases in their costs and insurance premiums to be able to provide that care. So all around, the healthcare status quo is unsustainable. So where do we go from here? I think we need to take a step back and really ask ourselves the question of, what is the primary business of healthcare? Is it to make sick people better? Is it to keep people healthy? Or it's both? Now, I'm going to argue that it's both, but I think it's important to note that our healthcare system, as it stands today, was based and built on this premise of making sick people better. And so our fee-for-service reimbursement model rewards volume and really rewards this concept of making sick people better. When somebody comes to our doors, we provide care, then we get paid for it. Our current model does not support this concept of keeping people healthy being part of our core business. Now, payers are starting to shift and align reimbursement to incentivize this behavior, and that's called value-based reimbursement, which I'll talk more about. But as it stands today, in order to incorporate this concept of keeping people healthy into the core business of healthcare, our reimbursement model needs to fundamentally be overhauled and shift from this true volume-based reimbursement model to more of a value-based reimbursement model. So let's talk a little bit about value-based care. What is it? Well, it starts with a couple foundational concepts. First, it involves, at the core, a relationship between a patient and their primary care provider, with that primary care provider really serving as the quarterback for their care. So the primary care provider ensuring that that patient receives the appropriate preventive care on a regular basis, and then if they have any chronic conditions, that those conditions are monitored and managed appropriately. Then when that patient requires a higher level of care, so a specialist referral or a procedure, that there also be a specialty physicians as well as a health system really partnered with that primary care physician to be able to deliver high quality care and in a much more coordinated way so that we can avoid unnecessary costly complications, like a patient coming back to our emergency room after having a procedure, or a patient coming back to be readmitted after they're discharged from one of our hospitals. And that kind of foundation of primary care, partnered with a high quality collaborative group of specialists and a health system, I would argue provides not only better quality and safer care, but at a lower cost. So we're actually able to lower the total cost of care. And what does that translate into? It translates into lower insurance premiums. It translates into more affordable care for patients, for employers, and for the government as our largest single payer. It also creates savings that payers are able to share with hospitals and physicians and reward them for keeping patients healthy and outside the four walls of the hospital. So it's a fundamentally different way of incentivizing behavior. So what does value-based care look like as it relates to the demand for core hospital services, such as the services offered by Munson Healthcare? Well, you can see my very simple bar graph there. We project that over time, our demand for core services is going to continue to go down. We've actually already seen this occur, and I can give you a couple examples of those shifts. First, a total knee replacement. So several years ago, if you received a total knee replacement, you stayed in the hospital for a couple of days. That was an inpatient procedure. Now, the majority of our total knee replacements are done on an outpatient basis. And just this year, Medicare made that same shift with total hip replacements. So we are going to see this continued shift away from inpatient to outpatient settings of care. We are also seeing a shift away from high-cost settings of care to lower-cost settings of care. And a great example of that is a shift away from receiving care in an emergency department to lower-cost options, which include an urgent care, walk-in clinic, physician office, or even a virtual visit. So we believe that we are going to see that trend continue. And at Munson Healthcare, we were anticipating this. We saw on the horizon that these changes were coming and that we needed to prepare for these changes, that reduction in volume, and that fundamental paradigm shift in how we're paid from volume to value. So that is why it was a foundational element to our 2025 strategic plan, and we call that Transform Care Delivery. So before COVID, we as an industry were facing an unprecedented change. So a change in our core business from not only taking care of sick people and making them better, but also trying to keep people healthy, and associated with that, a paradigm shift in how we're paid for those services. So now you place a pandemic on top of that, and I'm going to talk about the impacts of COVID-19 on the economics of the healthcare system. And I'll start by just illustrating the unprecedented business disruption that we experienced associated with COVID-19. And I like to illustrate with a picture, so I'm going to use a graph. So the graph that you see, that red squiggly line, that represents the inpatient census, so the number of patients in the hospital at Munson Medical Center here in Traverse City on a daily basis, and that is our fiscal year 2019. And you'll see that area circled in yellow, that dip, that blip in that red line. You might remember the polar vortex that occurred in the winter of 2019. During the polar vortex, we experienced what we called at the time a significant and sustained reduction in our volumes. And that significant sustained reduction in our volumes basically wiped away our operating margin for that quarter. Because remember, we get paid based on the volume of services we provide. So when our volume goes down, our revenue goes down, our financial performance suffers. Now I'd like to put that in comparison to what we saw with COVID-19. So the graph on the bottom here illustrates the same inpatient census for Munson Medical Center for our fiscal year 2020. And you can see that the polar vortex looks like but a blip on the radar compared to the volume decreases we saw with COVID-19. So if that little blip had such a significant impact, imagine the significance of the financial impact associated with the bottom falling out of our volumes that's illustrated in that bottom graph. The good news is that through the CARES Act and through other federal and state grant programs, we've been able to stabilize in the short term and make up for at least some of the losses that we have sustained through COVID-19. So what is the economic impact on that significant business disruption on the healthcare industry? I'm going to break it down into the short-term, mid-term, and long-term impacts that we're seeing. In the short term, we saw our elective business gone overnight. We closed services. We had other services whose volumes were down 80 or more %. So the significance of the impact on our volumes, I can't underscore enough. We also saw community members afraid to seek necessary emergency care in our emergency rooms. They were afraid, and we've had to do a lot of work to try to rebuild the confidence in our communities that they can safely receive care in any of our facilities. In the midterms, if I look out over the next year, as we reopen our services, we are not anticipating that our volumes are going to rebound to pre-COVID levels. And we're already seeing this as we call patients to try to reschedule care that was either canceled or postponed associated with COVID. Patients are actually declining and refusing to reschedule those services. And that's not unique to Munson Healthcare. As we talk to our colleagues across the state and across the country, all other health systems are experiencing that same phenomenon. We also, over the next 12 months, are facing a great deal of uncertainty. One element of that uncertainty is what's going to happen with the virus. We know that we're going to have to care for both COVID and non-COVID patients, but are we going to have a second peak, and how is that going to impact our ability to care for the non-COVID patient population? We also are unsure on the impact of our unemployment rate and job losses and insurance coverage. So are we going to see more commercially insured individuals shift to either being uninsured or covered by Medicaid? When we look out over the long term, on the 1 to 2 year time horizon, we're still not anticipating that our volumes are going to rebound to pre-COVID levels. And I'm going to talk about why in just a minute. We also see on the horizon that due to declines in tax revenue, as well as all the stimulus spending that has occurred, that we have an impending federal and state budget deficit that has to be dealt with. Healthcare is a significant line item in both those federal and state budgets. So we're also anticipating that our reimbursement is at risk to go down associated with filling or addressing those budget gaps. So I'm going to go back to my simple bar graph here and talk about now, remember, we thought that there was going to be a steady decline in the demand for hospital services as a result of this concept of keeping people healthy and outside our four walls, as well as the shift of care from inpatient to outpatient and high cost to lower cost settings of care. Well, that red line represents what we project to happen with COVID. So essentially, what COVID has done is accelerate that reduction in volume. Now, what does that mean to the healthcare industry? I think you can really sum it up in 2 words: accelerated change. I'm also going to break that down, though, in the short, mid, and long term. So in the short term, what we've seen across the country are healthcare systems making significant adjustments to their historic cost structures to come in line with the new normal, our new level of volume, those reduced volumes. Similar to what other industries are having to do, like the restaurant industry, associated with lower volumes. It's not unique to healthcare. We've also seen a very rapid adoption of telehealth. And what was thought to take years took weeks. And we know that that is going to have a lasting impact on our care delivery model. In the midterm, over the next 12 months, we see a great deal of work focusing on the redesign of care to improve efficiency as well as quality, and a really accelerated preparation for value-based reimbursement, and focusing on organizing our resources not just on making sick people better, but also on keeping people healthy. And in the longer term, associated with the overall economic impact to employers, those budget deficits at the federal and state government level, we are anticipating that all of our payers are going to be shifting more rapidly to value-based reimbursement arrangements. So the bottom line is that the healthcare industry was facing a period of significant, unprecedented change pre-COVID, a fundamental paradigm shift in our core business model and the way in which we get paid. What COVID-19 did is simply accelerate that, and I would argue created that burning platform for change that we need as an industry in order to make this paradigm shift. So as a healthcare leader, we have a lot of work to do. We have a challenge ahead of us. I'm confident that we will be able to innovate, adapt, and ultimately be successful in making this change, and that we'll look back on COVID-19 as truly being the catalyst that we needed to transform the U.S. healthcare industry. Thank you.